Hi, I'm Frances Gardner from the University of Oxford Centre for Evidence-Based Intervention in the Department of Social Policy and Intervention. I'm going to talk about parenting programmes to prevent violence. Are they effective, transportable, and could they be civilising? Just give you an outline. I'm going to give a very brief bit of rationale and evidence for parenting interventions, which will be very obvious to many of you. And then I'm going to go into 7 questions about the challenges and possibilities of parenting interventions. And these will include looking at how transportable they are across cultures and countries, how can we implement and sustain with fidelity, especially if we're thinking about low and middle income country contexts, how can we improve their efficiency, what subgroups might there be that do or do not benefit from these interventions, how good are the long-term effects, and can we trust the data? Now, Manuel asked that we thought outside the box. That's the difficult bit. So I just thought I'd add, would taking a historical approach a la Steven Pinker and Manuel Eisner, would that help us to think about how we do these things? I want to acknowledge funders who've not only funded work, but in many cases have inspired the whole projects. And I know that there's no funders here because they're all in another session about funders. So it's not meant to be flattery to anybody, but lots of people have helped a lot with that. A bit of background. As you know, youth violence and antisocial behaviour are common and persistent. The early risk factors include poverty, violence in the family, and in the community, and poor parenting. And since both the violence itself and the risk factors tend to start early and to persist, then that gives us quite a lot of possibilities for early detection and prevention. Parental violence towards children shares many similar risk factors with child violence, and the prevalence tends to be high in many low and middle income countries. And in common with the similar risk factors, then randomised trials suggest that parenting interventions can be effective for reducing violence both to and by children. And this is reflected in a number of global policy initiatives. So what's the evidence on a postage stamp about what works and for whom? Well, there are literally hundreds of randomised controlled trials of parenting interventions and many good systematic reviews, many Cochrane and Campbell reviews, which I'd recommend to you. These suggest that these interventions can reduce behavioural problems and aggression in children and in teenagers. They can reduce harsh parenting, improve positive parenting, and improve relationships. They seem to be particularly effective for children between the ages of about 3 and 10, and especially those showing some level of behavioural problems, which may be a kind of risk for behavioural problems, or mild or moderate or severe levels of those. I think the evidence is somewhat less clear about whether universal parenting interventions work. There's some trials that find good effects and others that don't. And they seem to be effective in quite disadvantaged groups, such as lone parents, those living in poverty, parents with mental health problems, and so on. And there are some moderator studies suggesting that these effects the effects can be just as strong or even stronger in more disadvantaged groups, and that's a couple of our moderator studies from our trials from the US and the UK. What works where? The randomised trials have been in many different countries, although the most are in North America. There's also a large number in Europe and in Australasia, but also increasingly in Asian high-income countries. What about low and middle-income countries? Well, the evidence base is weaker, but I don't think we know nothing. And we recently did a systematic review which found a dozen randomised controlled trials in low and middle-income countries of parenting interventions. Most of them were in middle-income countries, although there was a couple in Ethiopia. And the results were promising. The quality of the trials was variable. And that paper you can find in Prevention Science. So if there's been so many successful trials, then why don't we just roll out parenting interventions everywhere? What are some of the challenges? So the first challenge, I suppose, is how well does the evidence transport across countries and cultures? So we've got strong evidence from trials in, I estimate, at least 30 high-income countries and another dozen or so low- and middle-income countries. There are a number of additional trials since the review that we did, so it's a fast-moving field, and in 5 continents. But the questions remain, if studies have been done in 42 countries, then will the programmes work in the other 167 or so countries in the world? How can we predict what will work in a new context? If we're unsure about whether to import programmes from somewhere else or not, then is it better to grow our own programmes or to import evidence-based ones from other countries? And if we do that, then how much adaptation is needed? And how much does this affect engagement and outcome? And I suppose we need to think about avoiding the potential trap where greater levels of adaptation or just being a homegrown programme may lead to much higher rates of local acceptability within services and political acceptability and high levels of client engagement, but potentially can lead to lower levels of effectiveness. And there was a nice trial by Denise Gottfredson in Washington that essentially found something like that. Obviously, there's a lot of experience in the field about transporting interventions across cultures, many trials, many anecdotes and so on, but is there any systematic data looking across the whole field about whether transportability is a good thing or not? We recently conducted a systematic review about this question. We set a fairly specific question to make the review manageable, but we're now doing a much bigger review of this question. But the question we set was about whether parenting interventions in the sort of 3 to 10-year-old age range, whether that were aimed at reducing children's behavioural difficulties. Oh, sorry. We were interested in the question of whether programmes that have been tested in one country, what sort of effects you got when you moved those programmes and tested them again in another randomised trial, but in another country. It happened that all the trials that we found that met our criteria, there were 17 of them, were branded programmes which were manualised and quite well disseminated. But it was interesting that, judging from the trial reports, the levels of adaptation that were done to these programmes before they were transported to other countries were not, there didn't seem to be a huge amount of adaptation that went on. But interestingly, the effect sizes were just as high for these interventions when they were moved to a new country as they had been in the origin countries. We then went on to look at whether any kind of country-level factors about the countries where the trials were done predicted the effect sizes within this meta-analysis. And surprisingly, we found that country-level contextual factors for the country where the trial was done did not predict the effect sizes. And we looked at cultural and policy and economic factors and classified the countries where the trials were done in those ways. So, for instance, the effects were just as strong in countries with very different family policy regimes and cultural values as in countries that were much more similar to the origin country where the intervention came from in the first place. So, for example, an Australian programme such as Triple P got higher effect sizes in Hong Kong and Iran than it did in the UK. But the UK, of course, is much more similar in terms of its social policies and culturally and economically to Australia than those other countries are. So it suggests that despite wide variation in country characteristics, transportation may still be possible, even with not terribly extensive adaptation of programmes, and that the possibilities for transportability don't necessarily need to be limited by contextual differences.
Can I just ask, are you talking about outcomes of parenting skills or outcomes on child behavior?
Sorry, on child behaviour. Yeah.
On aggression?
Yeah, on aggression and conduct problems in kids.
And Francis, may I ask colleagues if they'd rather be cool or quiet?
Quiet.
Shall we close the window and then if people start getting too
it is
warm,
quite
let
hot,
me know,
isn't it?
but I think
Yeah, okay. I mean, there are huge caveats around this review. It's small, it's not very well powered for all these subgroup analyses, and so, but it's still interesting that some of the results were going the opposite way to what you might think, and so on.
But when it doesn't work, it's probably not published anywhere.
Yeah, that's a problem, I suppose, with all reviews of effectiveness, potentially. If we pre-registered all our trials, then we'd never have that problem, and so we should do that. These were the countries where we found replications of these programs in a further randomised trial. So that was our kind of sample of trials. And that's just to give you an example of one of the many analyses we did. We classified countries based on the World Values Survey we classified countries in terms of the kind of predominant family values that adults report when they answer this World Values Survey. And one of the categories that the survey makes is dividing countries into whether people are in general more focused on self-expression, like Americans, or whether they're more focused on survival, like in many low middle-income countries. And if you look at you'll see there's quite an effect size difference between the trials that were done in high survival countries and the trials that were done in high self-expression countries. But it doesn't go the way around you might expect. So there were stronger effect sizes in the survival-focused, in the countries where, in the trials done in the countries which are survival-focused versus those done in the more self-expressive countries like the UK and so on. And that difference was significant. But with all the caveats I mentioned, I think this is an interesting way to test transportability. But it's a small meta-analysis, and we're going to do a bigger one. Secondly, and I think the $64 billion question, which I'm not going to answer, is whether we have the capacity to implement these programs with fidelity and to sustain them, especially in low-resource contexts. And all sorts of questions we need to ask ourselves about what kind of service systems are best suited to engaging families and to implementing and championing this work and making sure that it's sustained. And as an example, we're working with Cathy Ward and Jamie and others on initiative and WHO initiative called Parenting for Lifelong Health, which involves developing and testing in randomised trials generic parenting programs for learning parenting skills based on the best of what we know from evidence from other countries. And so one of the principles behind it is thinking about how they can be delivered and sustained with relatively low cost staff and in real life settings. Can we make parenting programs more efficient and effective, briefer, cheaper, easier to deliver, but still have strong effects? There's a number of ways of thinking about that. One is to think about what are the essential components of parenting interventions, and that's been talked about a lot in this meeting. And we have a UBS Optimus review underway, using multiple methods to meta-analyse the data on essential components. A different way of looking at that, rather than slimming the programs down to their essential components, would be to think about what kind of new media might work. And I know lots of people have ideas about how you could use web-based programs, reality TV, soap operas, and so on. But there are actually a number of randomised trials of these kinds of methods. So there's data as well as good ideas out there. And then we might also want to think about how we make face-to-face interventions briefer. That could involve looking at the essential components. And there's some very nice trials done since we did our systematic review of people using briefer face-to-face interventions in low and middle-income countries and doing very nice randomised trials and consumer testing studies. And these are studies in Indonesia and Panama. They're all using triple P, as are most of the media-based interventions as well, which is interesting. And I really think they've been kind of ahead of everybody else in the ways of thinking about how you could make these things briefer and more usable and potentially more sustainable. But of course, the big problem is that programs like Triple P are really too expensive for low and middle income countries. So I suppose the lesson would be to develop our own low cost versions of these, because the ideas are not Triple Ps, but they've taken that much further than other people. For whom do they work and not work? Even when programs are delivered with fidelity, they don't work for everybody. So the question is, can we identify subgroups who need additional or alternative approaches? I think Nancy was talking a bit about this morning. But another important question, if we think about scaling interventions up across a whole population, so you're taking kind of public health approach, and we do want to think about whether the effects across a population would be to widen or to narrow social disparities. And the data is quite reassuring from some of our admittedly quite small trials that the most disadvantaged families can benefit at least as much, if not more, from these interventions. But I think we need to be pretty sure, especially if we do take things to scale, So obviously when you test something in a randomised trial, you learn that, and it works, and therefore you want to continue to roll it out, you learn that the mean level of the problem improves. But what you don't know is whether you could be increasing disparities. You could have a very disadvantaged subgroup that were getting left behind, if you like. And that's potentially a problem for many public health interventions, that the most able and well-off people take those interventions up better than the others, and then you improve the mean level of problems, but you also increase social disparities. So we need improved methodologies for identifying these intervention moderators. At the moment, we basically look at moderators within trials, and then most of them are underpowered, especially for testing multiple moderators or for looking at multi-level moderators. And I suppose one answer, and it's beautifully written about by Hendricks Brown in a recent paper in Prevention Science, is to do data pooling studies that aggregate individual participant level data across multiple trials, and these are also known as individual patient data meta-analysis, and they're quite different from regular meta-analysis where you're just looking at the average level of poverty or the average gender composition of a trial and looking at how that predicts variation in outcome. Just to very quickly to say that we're very excited to be beginning one of these studies where we're pooling the data from 14 trials of the Incredible Years parenting programme across Europe to try and answer these questions about social equity. A fifth challenge, are the long-term effects any good? This, I think, is quite a big problem. We have one or two programmes where there's very good data on long-term effects, such as David Old's programme, but generally we only have long-term effects for a rather small number of developer-led trials of their own programmes. Many other programmes have followed up their participants for many, many years, but do look carefully when someone says we had 10-year effects on our intervention, because quite often they have no control group anymore. It started off as a randomised trial, and then you'll see a nice paper saying 10-year follow-up of a randomised controlled trial of a parenting intervention, but actually in many cases they lost the randomised comparison group a long time ago, like after the first year or so. And that's generally because a lot of people do waiting list designs. So I think, if you have the choice of not doing a waiting list design, please do, because you'll never find out the long-term effects if we keep on doing these. And I regret the trials that I've done with waiting list designs, which I didn't really explore whether it was possible not to do that. But also, would we really expect the effects of interventions to last for years and years? Maybe we need a model which incorporates continuing booster sessions, perhaps at much lower intensity. And an example would be Tom Dishon's family checkup model, which explicitly incorporates that into the intervention. Do we trust all of the data? Randomised trials are the best way we have of establishing the causal effects of interventions, but there's many things about them that could be improved. Methodological problems mean that many of the effects of trials may have been overplayed. This has been written beautifully about by Ben Goldacre in his book called Big Pharma, about pharmaceutical companies, which that book is a eulogy to systematic reviews and the transparency that goes with them and things. I think it's wonderful. But in this field, we have problems of conflicts of interest, poor reporting standards, high risk of bias, underpowered trials, and quite a lot of cherry picking. But on the good side, we have outstanding strategies, I think, to solve these problems. There has been a lot of work on trial conduct and reporting guidelines. There's a new consort statement coming out for the reporting of randomised trials in the social and psychological area. There's a new Society for Prevention Research Standards of Evidence paper coming out soon. We should all be, and both those initiatives encourage people to pre-register trials, which prevents a lot of cherry picking. There are campaigns to have open access to trial data so that people can reanalyse them, people who are not so biased, if you like, towards finding particular results. And that includes the pooling of individual level data. Now, in case anyone might come away thinking these were particular problems with randomised trials, these problems apply to all evaluation designs and more so to non-randomised designs, because it's even harder to be sure about the risk of bias and so on. So how can we encourage all the actors in the field? So that includes the people conducting research, the people summarising it in systematic reviews, the funders, the consumers, everybody, to buy into these highest of standards. And there's quite a limitation that we have that most of us have vested interests, and our vested interests as researchers is often to find the most interesting and positive results. Just going a bit away from the normal box, can a historical approach help us to develop a framework for violence prevention? There's been a conference theme about the reduction in violence over historical time. And the question is, can we use knowledge about the causes of these historical reductions to help us reduce violence further still? And one question is whether the risk factors for antisocial and violent behaviour may have changed over time. And if so, do those changes line up or correlate with changes in youth violence? And if so, might they have a causal role? Pinker argues for a civilising process as being a kind of causal determinant of the historical reduction of violence. And I suppose we could think of parenting as a very, very nice example of a civilising process. Whether it's a cause or a kind of reflection of those social changes, I don't know. But we could ask, is there any evidence on how parenting has changed over time? There's very little data available, so we conducted a review and analysed 2 UK data sets that were able to look at this question. The main data set we looked at was from a representative UK sample of teenagers who were asked in 1986 about the parenting they received from their parents. And then the same questions were repeated 20 years later with a new set of nationally representative teenagers. Opposite to what we expected at the time anyway, when I hadn't read Pinker or anything, we were really surprised that parenting had improved, and I'm sure that the person on the street in the UK does not think it's improved. There was closer parental monitoring, the kids reported stricter expectations, that their parents put stricter expectations on them 20 years later, but also that they spent more quality time together and could talk to their parents more easily. And this is really supported by time use data from many more countries, showing that the time that parents spend with their kids has gone up over the last 40 years or so. And then we've also heard Finkelhor's data about reductions in physical punishment over recent decades. Those are just examples of parent monitoring improving according to Kid Report. So how can we nearly finished? Right. How can we accelerate this civilising process? So one obvious thought would be to have parenting interventions that operate at a community level to change norms. But at the same time, I think we need to be cautious, and Kathy said this on day -1 here. It may not be any good telling people not to hit their kids unless you give them some alternative strategies. So it needs to involve more than just telling people what they shouldn't do, but what they should do with their kids. I'd want us to be cautious about over-enthusing about interventions to tackle norm change. As far as I know, and it's outside my usual comfort zone, so I don't know, but as far as I know, we lack really decent causal evidence about how best to propel family norm changes. We have lots of ideas and lots of examples, but I understand that there haven't been good tests of their causal power. And in contrast, of course, we have lots of evidence about how to change family-level strategies and behaviours at that level about positive parenting. But we're not so sure about universal approaches to change parenting behaviour, and even less do we know about universal approaches to change parenting norms. But if other people know about good data on this, it would be good to have a conversation about that. There's many other caveats. For instance, what do we do about the fact that asking parents not to hit their children goes against predominant cultural values? The UNICEF Discipline Report makes really interesting reading. They show, as you would expect, very high levels of corporal punishment of kids in many low and middle income countries, but also a lot of variation between countries. So immediately you're doing something culturally inappropriate if you're going to ask people to do that. But at the same time, they also ask parents if they approved of the corporal punishment that they themselves did. And the rates of approving of the corporal punishment in many countries were quite a lot lower than the rates of doing it. So that kind of made me feel that people were ready to change, and it's not necessarily terrible to go against established cultural practices. We've got to carefully test any new kinds of interventions. Ideally, they'd be in cluster randomised trials, but if not, then we must use the very best of what we know about non-randomised strong causal designs to test these interventions, rather than just slipping back into kind of pre-post studies or others where you can't really draw any strong conclusions about the effects of the intervention. And I think there's a lot of interest in learning more about these techniques and using them, such as time series analysis and propensity score matching and so on. And then if we are going to do packages of interventions at different levels with multiple components, then we do need to be careful that we measure different elements, that we can disentangle the elements and actually work out which things are driving change and not just mush everything together. Okay, so my main conclusions to policymakers and funders, and whoever's here, would be, above all, to lend your vital support to bolstering strong, transparent methodologies for testing causal effects of interventions, because otherwise we're just spending money on things that look good but we don't know if they work. And that's so important, and that's even more important in low and middle income countries where we have even fewer resources. And we certainly, I would argue, don't want a lower standard of evidence for a low and middle income country. If anything, it should be higher because of a lack of resources and because of past wrongs, I suppose. History may suggest norm changes are key, but the intervention evidence suggests it's behaviour change that's important rather than attitudinal change in affecting health outcomes. So we want to be cautious, but also think about how we might best combine the two. We need to find better ways to make these interventions sustainable. And then I'd add, maybe a bit more controversially, don't worry about whether these programmes necessarily need to be homegrown in order to work. And this is, I suppose, directly addressing what Nancy said earlier. That in the hands of staff with local cultural competence, obviously you don't just walk in with a programme and have some English person doing it in Rwanda. In the hands of staff with local cultural competence, imported intervention strategies appear to be surprisingly widely applicable. Now, why might that be when our cultures and our systems are so different? Well, I think it's because good programmes manualise not just the content of a programme, which is the parenting skills, but really good programmes manualise the collaborative approach to working with parents, the listening to parents, the way that you're going to deliver the intervention. And then if they do that well and it's delivered with fidelity, which is a big if, then you hopefully wouldn't get the situation where the mum said after the programme, I didn't like all that stuff about discipline because actually what I really want to know is what to do when my 5-year-old says I'm going to call up Child Protective Services and I don't know what to do because I can't speak American. So hopefully that wouldn't happen, that it would come up in an ideal world, that would come up in the programme under the subject of discipline, and the training and the manualisation of the programme and the certification of people would require that they listen to parents' views, they listen to what the parents say about how the strategies they learnt worked in practice, to come back and talk about it, and to rethink the things that don't fit well with the person's situation. There's lots of references. Do ask for them if you want them. Thank you.